Welcome, everybody. My name is Johnny Ross, and I'm the founder and CEO of MedHab. We are a remote wearable technology manufacturing company. Two of our technologies we'll be talking about today is Steprite and MyNotifi RX. We'll also be talking a little bit about RPM, remote physiological monitoring, and how that benefits your patients. We welcome you to today's call. So today we'll talk specifically about improving patient care while enhancing office revenue. And we're going to do that through the eyes of primary care to give you that perspective. Today our speaker is Dr. Jay Morris. He's a board certified family physician. He's a member of the American Academy of Family Physicians. He's a health plan medical director, and he's also medical advisor to MedHab. As a disclaimer, I do want to let you know today you will be seeing information about specific CPT code reimbursements. Just to let you know, those were obtained through research in the North Texas area. So the dollar values that you see may be slightly different in your community. Real briefly, we'll go over the agenda. Well, obviously we just did an introduction to myself and to Dr. Morris. We'll talk briefly about telehealth. Of course, taking care of your patients for the long term, technology that can help you do that, a very important exercise platform that mitigates falls by as much as 46%, and of course, what's near and dear to everybody's heart, and that's reimbursement for the work and the good stuff that you provide your patients. And then we'll talk a little bit about setting up and a call to action. Without further ado, I'd like to turn it over to Dr. Morris at this time.
Hello, everybody. Johnny, I want to thank you for the opportunity to be here, and I want to thank all of our listeners for the time that they're going to spend with us today, and I hope it's beneficial in many ways. To start out, it's obvious that primary care providers in today's day and time have an awful lot on their plate. To provide high quality primary care in today's environment is becoming more and more challenging. One of those challenges is obviously access to care. How do you provide care to a member when you can't actually have them come into your office? How do you get paid for care that you give in a way that allows your practice to stay open in these trying times? So access to care is a major challenge. Another challenge is providing the highest quality of care. How do you follow patients when and if you can't see them in your office? How do you assure yourself that your patients are compliant or adherent to the care plans that you've laid out for them? Another challenge that's really more specific to tonight's conversation is the challenge by the Center for Disease Control related to stopping elderly deaths and injuries, the so-called STEADY challenge, the STEADY initiative by the CDC, where we've, as primary care doctors, we've been challenged to impact and to decrease the impact of falls in our elderly population. If you're familiar with the STEADY initiative, you know that it provides education and tools for you to impact and address falls in our elderly populations. And just to review quickly, many of you know these statistics already. Falls are the #1 cause of death and injury in our elderly population. Anywhere from 1 in 3 to 1 in 4 elderly patients fall every year, resulting in about 29 million falls, costing Medicare over $31 billion a year and resulting in 800,000 deaths. So the CDC has provided tools to help you screen patients, to help you assess patients, and then also to help you intervene. And one of the areas that in which they suggest intervention in the area where patients may be suffering from weakness or balance issues or gait abnormalities is to refer them to evidence-based therapeutic programs, and they specifically mention Tai Chi. Tonight we're going to go over another evidence-based physical therapy exercise program. I'll talk about it a little bit later in the program. So now I'd like to take a minute and talk about, as I mentioned earlier, providing access to patients, especially in our challenging environment today. I feel like I'm preaching to the choir to a certain extent. Many of you have already done much of this in terms of learning about telemedicine, learning about which is the best telemedicine provider for your practice, and determining if the best use of telemedicine in your clinics, which are the best patients to see remotely, which are the best patients to see in your office. Much of this work you've already done as a result of the current environment in healthcare. And fortunately, the payers are beginning to reimburse for telehealth. So this ties in nicely with what we're talking about tonight. As a health plan medical director, one of the things that I've consistently supported was the concept of having telehealth, telemedicine morph into wellness programs for monitoring chronic disease patients. And so the timing is right, especially as it relates to falls and hip disease and knee problems and that sort of stuff, because arthritis is considered a chronic disease. Okay, so I'll turn it over to Johnny to talk a little bit more about the technology.
Thank you, Dr. Morris. Appreciate that overview of RPM. Continuing down that line, obviously for RPM to be successful in the practice, there has to be technology available that can provide the data necessary from which to make clinical judgments. MedHab has two such technologies. One is called Steprite. You think of Dr. Scholl's insoles. They're very malleable. They have all the technology resonant within the insoles. And the physical therapist is able to set a rehabilitative protocol, or you doctors can set a rehabilitative protocol to manage your patients. It's really a lower extremity device, obviously, because it's worn in the shoe. And the exercises can be performed anywhere through an app, as you see on the screen. MyNotifi, which we're morphing into MyNotifi RX, because MyNotifi is actually designed initially as a retail product for fall detection. But we put some American Physical Therapy Association exercises in there because we thought it was important that patients would have the opportunity to do some exercises if they so choose. However, with the advent of telehealth and RPM that's now here, we wanted to make sure that those exercises now could be provided by you through a portal to the patient. So now this device is not only a fall detection device, but it is a physical therapy device that links now the patient both to you as the provider and to their family in the event of an immediate situation. So MyNotifi is right here. This is Steprite. Here's MyNotifi. It can be worn on either wrist during these exercise times. Through an algorithm, it picks up all the different exercises that can be monitored if you wish. Here's a screenshot of the app. This is how it's shipped. It comes with the charger. It comes here with the wristband, and even this little band right here is an extender band because you may want to do some exercises that are specific to the lower extremity, and with that extender band, it fits around the ankle and you can make measurements from there, or your physical therapist can make measurements from there and see that data. But maybe most important here of note right now is that for RPM purposes, we also provide a free pulse oximeter that's included. And we'll tell you a little bit more why that pulse oximeter is in the packaging momentarily. So as I said, with MyNotifi RX, the added benefit is fall detection, going to what Dr. Morris said. And it's something that every 19 minutes a senior dies from a fall. So we can help with that because we can with our technology, the family can know about it very quickly. As you see down here at the bottom of your screen, the wearer of the device can designate whomever they want, however many people they want to be on their as an immediate caregiver. So for example, if it's a grandfather, it could be a living spouse, it could be adult children, it could be friends, family, neighbor of 30 or 40 years, it really doesn't matter. If they need help, everybody will know simultaneously, literally within milliseconds of that event occurring. If it were a fall, for example, right here as you can see in the middle, it's simple. Either they can touch their smartphone because the smartphone talks to them, or they push a button on the device, and matter of fact, here's the device. They simply push a button. If they've fallen, what happens is the device starts to vibrate and or the phone starts to communicate with them. And the reason why, well, why would it do that? They know they've fallen. Well, it's to cause them to do an action. That is either, verbally command the phone that they've fallen and need help by saying yes, or pushing the button says yes, that they need help. It lets the family and friends know that they have fallen and they need help. It comes to it by way of a MyNotifi precaution. Or let's say they fall and it's of more violent nature and they're incapacitated, perhaps unconscious. At that point in time, the device will continue to talk or vibrate for 1 minute. Once that timer is off, it sends the message right away to the families. In this case, though, it's a warning and lets them know a fall occurred and that the user of the device was unable to deactivate that or disable it. And it's not all about the fall. I mean, there may be times where they may have other conditions, or they just may not be feeling well. Maybe they're lying down or in a chair and they can't get up. They can push the button on the phone, or they can push the button on the device, and it will send a request for help immediately. So the family will know that they need help. And the beauty about it is if one person is responding, the entire network of caregivers sees that, so they know that help is on the way and who is coordinating that help. MyNotifi is also waterproof, and for fall detection purposes, it can be worn on either wrist. It can be worn in a shirt chest pocket. It's small enough that a woman can even tuck it into her bra. We even have a belt clip that it can be worn. And we're actually now creating another little clip that can be worn just on the inside of the shirt right up here, because some people may not want to put it in a shirt pocket. They're afraid of losing it. We'll have that taken care of in the very, very near future. But I do want to let you know, both of these technologies are also FDA Class 1 and Class 2 exempt devices, respectfully. They are both HIPAA secured and meet FCC regulations. So when you use the technology, or your therapist use the technology, and Dr. Morris will talk a little bit more about why, where, and when it's appropriate for either or, these are some of the very simple dashboards that can be gleaned on a daily basis. You see here, this is a force distribution if they're using Steprite. You can see if they're standing on one foot more than the other, if they're behind the ankle on the ball of the foot, if they're supinating or pronating, it's all there. You can also see the line here if they're relatively close to symmetrical. And these are all day and time stamps here, so you know that they're doing what you've asked them to do. If they're using Steprite again, here's your traditional gait analysis graph that you will see. This comes straight out of the textbook, but again, it's the same principle, and it shows if they're heel to toe striking, they're able to move from supination to pronation. When using MyNotifi, there'll be more, obviously, compliance reports as well as range of motion. Here's an example of a heel raise. It shows here left and right foot degrees. It even shows here in red if the patient is able to meet the number of repetitions that you have asked them to do, because maybe it's too difficult, maybe they have pain. It's something you can ask them about and find out why they're not compliant if that happens. As well, you can see bar graphs here. Here's an active resisted extension of the arm. You can see here the degrees of motion going across here. You can click on speed, and you can see the speed of that in milliseconds bilaterally. You can see the repetitions or the degrees as we have here. So any type of degradation that you're seeing could open the door for a productive discussion with the family and or your patient. Also, to let you know, for purposes of RPM, to make things easy, these reports really don't have to be reviewed on a daily basis. You may have your PT doing that, but that's okay. With RPM, we actually send a roll-up report each week with compliance, range of motion, gait, and standing pressure, so that you can see what your patients are doing. And you can designate anybody in your office, for the most part, to manage those reports, intervene, or engage your patients for the billable receipts through RPM. Here's just a blow up of that one report like I wanted to share with you here. You can see the time and day stamp better. You can see here this case for the test and the purposes of this is 3 out of 3 reps were achieved here, 3 out of 3 reps were achieved here. only 1 out of 3 here, 1 out of 3 here. So it shows you exactly what your patients can and cannot do, and even the degrees. And again, it maps that out over time so you can see if there's improvement or degradation. Dr. Morse, I'll turn it back over to you now to talk about Otago.
So this slide goes to the issue that we mentioned earlier related to evidence-based therapies that have shown to be successful in reducing falls. The Otago program was developed, as you can read there, in New Zealand, and studied vigorously and shown to reduce the risk of falls and fall-related injuries in high-risk older adults by 46%. That's pretty significant. I don't know what the science shows related to Tai Chi, but I think 46% is pretty remarkable. If we could cut those falls, those 800,000 deaths in half, what would that mean to CMS? It's an amazing program that is evidence-based and would certainly fit the criteria that have been laid out by the Center for Disease Control. Next slide, please. One of the things I like about the Otago program is that if you choose to get this training, you can go and get the training yourself, or you can work with your physical therapist and use not just the Otago exercises, but there are a number of other exercises and training programs that are programmed into this device. So if, for example, you have a morbidly obese senior and you want to prescribe nothing more than just a walking program, you can see whether or not the patient has been compliant with this, whether they're following your program, and see the results that they've had. So when they come back into your office next time, you can use that as a coaching session or as a attaboy, way to go sort of session, and show them that you are actively following their physical therapy. Or you can do this in conjunction with the physical therapist. So you'll see there references related to where you can go and learn more about the Otago program, and also where you can go to get certified if that's something that you're interested in. Next slide. So taking a step back a little bit, how do we integrate this into your practice, enhance the coordination of care using Steprite and MyNotifi and Otago? The technology allows for you to become more connected to your patient. It allows you to view data for coaching for the for the outpatient or in-clinic setting in the patient's home. And it's a way for practitioners to provide remote encouragement or continued coaching for their therapy, combining the three: Otago, MyNotifi, and Steprite. But again, I want to emphasize that it can be used in a regular physical therapy program as well. Next slide.
Integrating RPM in your practice is really not all that difficult. You know, as we talk about this, a lot of people wonder what's going to happen after the 1135 waiver. Well, most sources look at this, say telehealth and RPM is here to stay. I mean, in fact, RPM came out in late 2019, funded in 2020, as you can see here on this slide. So this is set up, it's not going away. And it's a program here to make a difference in the lives of our seniors, to keep them out of the hospital and save that $31 billion that Dr. Morris alluded to earlier. So now through RPM, Remote Physiological Monitoring Program, you actually have reimbursements for the device through a specific code, and I'll explain that to you momentarily. There's also reimbursement for your time, which is extremely valuable, and you have the ability on the documentation to delegate whomever you want in your office to handle this program for you and generate that revenue while you're still seeing patients and doing the things that you need to run your practice efficiently. So when you take a look at RPM, obviously, like I said, there's monthly billable codes that are there. It does require an annual consent. I mean, the goal of this is to have them continue on these technologies for as long as they possibly can. So at the end of 1 year, of course, that consent, you have to bring them back in and make sure their health is where you think it should be. But also to qualify for RPM, there's a few things that need to be in place. And those must be either weight, blood pressure, pulse oximetry, or respiratory flow rate. We have chosen pulse oximetry. It's easy for me to say this evening, isn't it? But we have chosen to put that into our technology because we believe heart rate and oxygen saturation, both resting before exercise and then in a non-resting state after exercise, is important. That can provide you really valuable information, the overall health of your patient, if there's anything going on, regarding their pulmonary ability. So that's really the rules that you're looking at, and it comes down, like I said, to just delegating that to whomever you want. Dr. Morris, would you add anything to that at this point?
No, I think that I would add the evidence of the pulse oximetry has to do with cardiopulmonary fitness. If you have patients that are compromised in any way, shape, or form, as you trend this, your office staff and yourself may actually be able to pick up deterioration in your patient at an earlier time. So again, that would go to the quality of care and picking things up early if we can. Try to interact with them before that becomes a crisis.
Okay, thank you. So who's reimbursing RPM right now? Well, the Advantage plans are Medicare. You have Blue Cross, Cigna, United. There may be others. These are actual ones that we have confirmed on our end at this point in time in the North Texas area. I suspect, Blue Cross, Cigna, United would be doing this more than likely nationwide. And I do know in certain states there are, slightly different rules, but for the most part, the plans are starting to pick this up readily because it just makes sense. And in the long run, it makes things more efficient and more cost effective. So as I said a while ago, the device can now be paid for through remote physiological monitoring. And here's how it's done. And there's absolutely no cash out of pocket to your practice. And I believe that's a very, very important point. And I'll tell you why. But first of all, with code 99453, that's a one-time code that pays, roughly $20 for that initial setup for the patient. In addition to that, 99454 can be reimbursed every month for the technology, and that's somewhere in that $63 to $64 range. So what we do, we bill in the rears, meaning 30 days post your prescription of that device to your patient. We then bill you. That allows you to get your reimbursement money and flowing from Medicare back into your office. So we bill you 30 days after the fact, $60 for the device monthly until the device is paid for. And that's how it works. So there's absolutely no cash out of pocket, no impact on your cash flow whatsoever. And the reason why I say that is because, I think that's a real important thing, especially in today's times with everything changing so dynamically. Even with our business, cash flow is of the essence. So I'm glad that we're able to do that through this program and build that out over time. Now, not only can can the device now be paid for through RPM, but your time and services. And here are the two main codes that you would look at. There are some other codes under RPM, and we have a full list of those for you. We can provide those to you should you choose to move forward and start your own RPM program with your practice. But these are the main two. 99457 is a precursor to 99458. You can see here it's an initial phone call monthly for around $50 reimbursement. And then another phone call, or after that first one is done, another one, maybe 2 weeks later, maybe the follow-up phone call, however you choose to do so. But now you're looking at almost $90 collectively for 99457 and 99458. Now, one of the things that I think is important to note here is MedHab is the manufacturer. There are companies out there, and not to disparage other companies, because there's a lot of good work being done in this space, but we're different than others because we are the manufacturer of the technology. There are companies out there that would like to participate and partner with you and help your patients. In some cases, those companies take all the CPT codes and do not offer anything back to you as the provider. I personally think that's a horrible business model, especially for you. There are companies that may partner with you and share in some of those reimbursements. They do some of the work, the provider does some of the work, but now you're sharing that, and that's not a bad way to go. We believe ours is a little bit better. In our case, we believe all the reimbursements for services rendered should be reimbursed and provided to you as the provider who's seeing that patient and making sure that our seniors are well and staying healthy. So in addition to the 99456 and 57 or 58 codes, you have this G code here, 61, 62, and 63. It's just a time continuum, as you can see here, 5 to 10 minutes up to 20 minutes. This can be billed weekly by you or a staff member for that $12 to $35 range, let's just say. So now you can see between the 99457 and 58, which is nearly $100. Now this could be, it may just be another 12 or maybe 30, but this could be something that's done weekly depending on what your patient specific needs are, and only you can determine that. So again, when you look at this, it's not too difficult to integrate RPM into your practice. If you just integrate your patient care, you monitor your patient's compliance between visits. Like I stated, we provide you with these weekly roll-ups and monthly roll-ups that are comparators. So you or your staff member who's taking control of this and engaging your patients, you can see it's all right there. There's not a lot of work on your end that you have to do. It's not only about, when they're not doing what they're supposed to do, but I think encouraging them to do what they are doing and continue to do well, probably even more important.
So John, if I could step in there for a minute.
Absolutely.
I think this goes to the concept that I mentioned early on in the introduction about assuring that patients are compliant and adherent to treatment plans. This technology gives you as a primary care physician an opportunity to play a more engaged and integral role in not only managing the health of your patients, but also being able to assure their adherence and compliance with your treatment plans. And I think that would also provide you an opportunity to be more impactful by using actual data and showing the patient that you are as actively engaged in their treatment to encourage them or to coach them and to help them get into a better state of health.
Excellent point. Thank you very much for bringing that up. You also have the opportunity to work independent of a physical therapist or with a physical therapist. I think Dr. Morris will address that a little bit more.
Yeah. So as I mentioned earlier, the Otago program is a training program that you could go to and become certified and trained. 17 exercises, very basic sort of exercises that would be very beneficial when it comes to helping your elderly patients with their gait and their balance and so forth. But just even simple walking programs. I mean, how many times do you tell patients just to get out and walk and you don't know whether they do it or not? Or you can stay engaged with your physical therapist and then provide more meaningful oversight and engagement with the treatment of your patients and the monitoring of your patients as they go through physical therapy. And one of the benefits of this is that the patients can do this at home. How many times do you see a physical therapist provide a home exercise program and the patient's non-compliant, they're non-adherent with it, and so they come back to you for acute therapy over and over and over again that provides marginal benefit, when if you could encourage them to use to follow their home exercise program, and for them to know that you're going to continue to monitor that on a weekly basis or on a continuing basis, I think it provides incentive on their part to fully engage in those home exercise programs and probably end up doing much, much better from a health perspective.
Excellent point. So when you take a look at generating revenue through remote patient monitoring, this is a calculator that was set forth by Medicare, matter of fact. They think of the average doctor might have somewhere around 200 patients that qualify for this program. And as you can see here, using the different codes that we just talked about, what that 200 patients could be worth in additional revenue to your practice. You do see the 99454 zeroed out, obviously done intentionally, because again, it's that is not coming out of your pocket. That's going straight from a Medicare reimbursement to you to pay for the device, and we bill you that in the rears, like I said. But to suffice it to say, with 200 patients, that can generate somewhere around $125,000 to your practice, plus or minus how many patients you might have. But you can see what the math looks like. And putting it all together, I mean, really, it's like I said, it's not a very difficult thing. And I mean, the initial success is just setting it up. Who is it that you want to delegate within your practice? I mean, it could be a nurse practitioner, a nurse, it could be an MA. Any of those apply as long as you designate them as staff to help you, medical staff to help you do that. What we help you do is create and register your account, which literally takes 10 minutes at the most. And from there, we also have little tutorial vignettes. They're 2 to 3 minutes each, shows you the technology, explains some of the stuff about RPM. We'll send you everything you need on that, but it's quite easy to do. Your NPI is important because we do send that NPI to Medicare to make sure anybody using our technology or participating in the RPM program, is licensed and in good standing. We know that normally within about 48 hours, you get an automatic notification on that, letting you know that you're free to go and start prescribing the device. So, what you see here is that you could do this initial testing and everything in-house, when the patient's there. It could be you, or again, a nurse practitioner, whomever can do some of this work. You can obtain baseline functional data, or again, this could be, referred out to your physical therapist, but you can do some of this stuff with the device, because as they do these exercises that you want, the data's there and the baselines are established. So you have it, and you can use that for other interventions, because it's all documented, as you saw on the dashboards. And so it allows you to, take care of that patient for the long term, hopefully to some type of clinical improvement of their condition or just their overall strength. Dr. Morse, you want to add anything on that, or did I cover that okay?
I think you did a great job, Johnny.
Okie doke. We'll go to the next slide. So going back to Dr. Morris's question a moment ago, so we do, the 99454 is billed for the device until, 2 months post that, because we're carrying the note. Then that 99454 from that point forward is your money. This does include a free medical grade pulse oximeter, as we talked about, and those reports are reported to you as well, so you can see if there's any pulmonary malfunction or not. As we stated earlier, you would bill 99454 to Medicare and get your reimbursement, $63 to $65. We simply in the rears bill you that $60. So the money circle, comes around without impacting your cash flow. And you can see here, based on this, if you're looking at about $150 per month, that's $1,800 per patient that you can make on an annual basis. And the beauty about MyNotifi is that it also is this fall detection device that doesn't just link them to you for the long-term care, so you can be a part of that as much as you need to be, but it also links the family for immediate type of assistance. You can see on the right side here, the Steprite model is the exact same thing. You may be wondering, okay, when Steprite and when MyNotifi RX? I think Dr. Morris outlined lots of good reasons when and how to use MyNotifi RX. Steprite, we haven't talked quite a bit as much about, but if you have those that have serious gait problems, potentially it could be a diabetic foot neuropathy patient. There are many other patients that you believe need more assistance with gait, because it really digs down deep into the gait and provides some information that might help you correct that gait if it's possible. On closing remarks, I'll keep mine simple. It's just 800-541-1420. You can call that number and one of our technicians will help you. They are not hard sell technicians. They're not trying to upsell you, because we're not selling anything. We're just, we just have the devices that are there. If you choose to participate in Medicare's RPM program, they're there to answer your questions, and they're there to help you set up an account when you are ready to do so. If you prefer, you can contact us, as you can see on bullet 3, at support@medhab.com. And, we'll help you. And on your end, it's real simple. Like I said, just designate whomever it is in your staff that you want to handle this program for you, to do the documentation, engage your patients, and you just manage it from a distance as you're doing the things that you normally do in your practice. With that said, I'm going to turn it over to Dr. Morris for our closing remarks.
Thank you, Johnny. First of all, let me say thank you to all of the primary care providers that have taken the time to listen to this. It shows, in my view, a very strong interest in trying to provide the very best care for your patients, and to have that impact that the CDC wants us to have with these very frail elderly patients. So thank you for that. Thank you for your time. We hope that we've shown you some technology that can provide some answers for your practice, not only as it relates to access to higher quality of care, but also to being able to provide a higher quality of care by being able to accurately monitor and document patients' involvement with, adherence to treatment plans. So thank you so much for the time that you spent with us, and I hope you have a wonderful day.
I'd too like to thank all of you for being on the call. Bye.